I left it. At a time, Joe, when we were only in the UK, at that point, there was only the recommendation for the vaccine to be given to people at high risk. I never expect, even then, like friends were calling me and younger people said, no, you don't need to take it. If you're under 50, you're fit and healthy. No. Even at that time. But this is just for high risk people. So I took it. I swallowed the pill. And then, I mean, things changed very dramatically within a few months.
Did you have any adverse side effects?
I did. And again, I didn't fully appreciate it at the time, but now I know the mechanism of harm. It makes sense. So I'm very much into my fitness, Joe. I've been like, I captain sports teams at school and university. I'm an obsessive exerciser, like every day. I don't feel good if I haven't gone to the gym and done something, almost every day. I started noticing within a few weeks that my energy level started to get depleted quite significantly. My sleep was disturbed. And then I went into clinical depression. I was diagnosed with clinical depression. Didn't take any pills. It was probably mild to moderate over a few months.
So when you say diagnosed with clinical depression, what's the parameters? Like, how is that defined?
Yeah, so clinical depression, you usually have to have a number of symptoms that are persistent for at least 2 weeks. So these are things like something called early morning awakening, low mood, lack of energy, negative thoughts for the future. There's lots of different criteria. And one of my family friends actually is a psychiatrist. And I spoke to him about it, and he said, yeah, this is depression. So but the one thing I noticed more than anything else is my energy levels were, I couldn't, like, I'm a very active, energetic guy, and I just couldn't leave the house. I couldn't leave the couch. I was completely depleted.
And what do you think, you believe is a side effect of the vaccine, but what's the mechanism?
Well, we know now one of the problems with the vaccine is that the spike protein, and there's different theories around this, from the vaccine that's injected into the arm, gets distributed throughout the body and can be there for up to 4 months. And what happens is it causes either direct, and there's published data on this, direct toxic effect to the tissues or an autoimmune reaction. So we're talking about the brain, the heart, the kidneys, the liver, the ovaries, and the testes. And that's probably the mechanism of action. And in fact, this is not, interestingly, one of the side effects from a World Health Organization endorsed list, which I reference in my peer-reviewed paper, which we'll talk about later, actually puts in there psychosis as one of the side effects of the vaccine. And there are case reports in people who went psychotic, actually, because of it. So
a significant number?
We don't know. We don't know the exact numbers, but one of the reanalysis of Pfizer's own trial by independent researchers published in Journal Vaccine, in the clinical trial itself, one of the severe adverse effects in the clinical trial was psychosis, at least in one patient.
So for you, with your case, how long did you suffer from these symptoms?
About 3 months. I mean, I went to a psychologist. I didn't want to take pills. So I went to psychologists, I had cognitive behavioral therapy, I started to just focus on going back to the basics, getting good sleep, resting, etc. And I came out of it, I came out of it slowly, I started getting my energy levels back. It took about 3 to 4 months.
Did you experience any cardiology issues? Was there anything with your heart rate? Was there anything with your immune system?
No, I didn't, Joe. I had 2 doses. I didn't get any of that stuff. No, I didn't. But then what happened was, just when I'm coming out of the clinical depression, I'm starting to feel better. And I told my dad about it. My dad was, we were very, very close. So he knew everything that was happening. One of the things, by the way, when people go into clinical depression, one of the symptoms is suicidal ideation, as in thoughts about committing suicide. That's actually one of the symptoms. And I remember going for a walk with him. I was feeling so low. And, I went up to visit him in Manchester, and I just said to him, I said, I'm having a thought of just, going and jumping in front of a car. It was fleeting. I wasn't going to do it. But right. I knew that I was that depressed that I was to have even that thought entering your mind. But anyway, I'm a resilient, tough guy. I just wrote. I knew I was going to get better. I just had hope, and I got better slowly with time. And when I came out of it, that's when, you know, a real sort of tragedy hit me again. Because me and my dad were still also mourning the loss of my mum. It'd only been about 2.5 years since my mum died. I get I'll never forget this, July the 26th, 5 p.m., 2021. My dad calls me and he says, Asim, I've got chest discomfort. And in medicine, 80% of if you're a good doctor, 80% of your diagnosis comes from the history. If you listen to your patient, then you will get the diagnosis just from that discussion. If you know, from symptoms, you can usually, and he said, what he described sounded cardiac, which is typically, he said, Asim, he's a doctor, but he was obviously a little bit concerned. I said, tell me about it. I said, how bad is it out of 10? He said, like 6 out of 10. Feeling a bit sweaty. I've got an ache in the center of my chest. I said, is it going anywhere? I said, yeah, into both shoulders. And for me, I was like, okay. It didn't sound like an overt massive heart attack, but it was concerning. I said, how long have you had it for? He said, I've had it for probably at least 20 to 30 minutes.